Hi everyone. I have a breathwork practice for you today. This is a yoga pranayama known as Kapalabhati, and it's the skull shining breath. This breath will have a cleansing effect on your respiratory passages. If you're a little bit stuffy, you might want to start by going ahead and blowing your nose. If you're really stuffy, you may find that this works better to wait until your nasal passages are a little freer, but you can explore to your comfort. And do check the notes for this video for any contraindications if you have health issues, just to see if this is going to be an appropriate breath work for you to work on or not. So for this, it's going to be best to be upright. So you can sit or stand. You want to be comfortable. So feel free to use your furniture if you like. You're going to start by feeling into your connection to the surfaces that support you. So the floor, the cushion, the chair, wherever you are, feel free to change up your leg position if that helps you feel more comfortable here. And as you're feeling into your connection to the ground, notice if you're working extra hard to sit tall. If you are, is it possible to release some of that effort so that you can really let yourself be supported by these surfaces beneath you? It does help to be a little higher, so I'm sitting up on a cushion. Sometimes that really helps if you're seated on the floor. Sometimes it also helps to change your leg position. And as you're feeling into your sitting bones, those bony points at the base of your pelvis, see if you can find yourself balanced between the right and left side and maybe just a little bit on the very front edge of those sitting bones. Taking some nice easy breaths here, just let your breath be. So don't worry yet about trying to breathe in any particular way. If you like, you can place your hands on your body, and one hand's going to go over the belly button, on the abdomen. The other hand's going to go over the breastbone, and we want it to be below the notch in the throat, below the collarbones, and otherwise up on the upper chest. And you're just going to notice as you're breathing naturally, what's moving. Maybe one hand moves more than the other, maybe one hand is still. Maybe there's an order in which you feel the hands move, or maybe they kind of move together. So you're just tuning into what's happening with your own breath and just trying to let your breath be as nice and easy as possible. So when we do Kapalabhati, sometimes my impression is it can feel a little strained for some people. It can be a little difficult to access. So we're going to play today with being a little slower in our approach and seeing if you can find a place of ease to work into this type of breathing. So the first thing we're going to do here is, with these hands placed, you're going to keep your breath fairly easy, but you're going to start to see if you can direct most of your breath up into the upper hand. So to do that, you may find the lower hand is not moving much or at all. And we're looking for the rib cage to expand, so you may feel some expansion up into the armpits as well, on the sides of the rib cage, and this upper part of the chest is going to kind of lift as you breathe in. And we'll take a few breaths like that, seeing if you can bring most of the movement up into the rib cage, but do that in a way that still feels relatively easy for you, so you're not overworking here. And if that's hard, you may take some time to just play with that piece. Can you shift the breathing so that you can feel movement in the rib cage and less movement in the abdomen? Just getting that skill in place can be really helpful. So now what we're going to do is we're going to see if you can breathe into the rib cage, feel that rib cage expansion into the armpits, into the chest under the hand. And then can you hold that lift and expansion in the rib cage as you breathe out? So if you're able to do this breathing into the rib cage, holding the expansion as you breathe out, you're going to start to feel a different kind of engagement down in the abdomen as you exhale. So this probably feels quite different than the way you were exhaling before. Exhales do have the ability to be fully passive, but for this breath work, we're working towards a very active exhale and a more passive inhale. So it's a really different pattern than we probably are used to using. So you're inhaling, keeping the expansion, exhaling, feeling the abdomen move as you breathe out. And then you're going to let all that go. Let your hands come down for a moment. Let your breath settle. Noticing how you feel. And then we're going to start to add a little more force to the exhale. So the forceful exhale for this breath is going to be really drawing in quickly and sharply the navel, the belly button, and the abdominal muscles. And that's going to push the exhale out of the lungs. And you're going to let the inhale come in, keeping that chest expansion. So it's going to look a little bit like this. Okay, you're going to inhale into the chest, feel the chest expand. Hold that expansion as you breathe out. And then inhale into the chest, feel the chest expand. Exhale with force. So I'm starting out at a very slow pace here. Take a break, see how that feels. Being willing to do Kapalabhati a little bit slower can be really helpful for feeling your way into the mechanics of it, and then making sure that you're not overdoing it for where you're at in your system right now. So we're going to go one more time. We're going to go for a little bit of a longer cycle here, and you're going to pick your own pace. So you might keep going really slowly. I'm going to speed up just a little bit, but I'm not going to go to a really fast-paced breath right now. So I'm going to keep a little bit more slow, intentional, deliberate breath as I go. So when you're ready, letting that settle out. You can work your way up to slightly longer cycles of this, but if you're new to this breath work, take your time. It gets easier with regular practice. So it's easier to do shorter cycles, but to do a few of them and to work your way up to being able to do more, paying attention to how you feel, right? Because that's at the root of the therapeutic yoga practice, is we want to make sure that we're paying attention to what happens when we do the breath work, how we feel before, during, and after. If you're struggling with this breath, I really recommend finding someone who can help you in person, a yoga therapist or a knowledgeable yoga teacher who's trained in this breath work and can provide you with some support and some troubleshooting in person. If you have just some easy questions, please feel free to ask them in the comments. I'd love to hear how you felt about this slower and more gradual approach to doing this breath and how you felt afterwards. So feel free to ask, share in the comments. I'd love to hear more, and take really good care.